We are talking about this disease. If it's a small stomachache, headache, we are not worried. But atrial fibrillation is a condition where the heart rhythm becomes very irregular. Sometimes the patient is not even aware that he has got this problem. Very often they go to, say, a physician with breathlessness saying they have asthma, they have leg swelling, several different symptoms. So as you can see in the upper panel, the normal heart beats from the upper chamber very regularly. I'll just show the animation so that you can see the upper chamber squeezes and then the lower chamber squeezes. That's all happens normally in you and me. Whereas in atrial fibrillation, for several reasons, what happens is the upper chamber starts squeezing like this. It's not squeezing at all, it's just fibrillating. So when the heart chamber doesn't squeeze, the blood doesn't flow from there, it sticks around and forms a clot. So these patients are at a higher risk of developing a sudden paralytic stroke, or they can develop heart failure and several other problems related to atrial fibrillation. So the reason why we are talking about this is, if a person at 50, 60 years of age develops atrial fibrillation, there is almost a threefold increase in death. So suppose out of 10 patients without atrial fibrillation, 1 out of 10 will die above 70 years of age. But if they have atrial fibrillation, 3 out of 10 or 4 out of 10 will die in the next 5 years. So the mortality increases. But the worst thing is they come with paralytic stroke. So you imagine a young person, 45, 50-year-old person, wakes up in the morning, cannot speak, cannot move. So for the rest of the life, he is confined to a wheelchair. So it is a tremendous drain both for the family as well as for the patient. It also increases the risk of heart failure. So heart failure, you all know, when it proceeds, you would have listened to transplant and expensive therapies. But the starting point is atrial fibrillation. The rhythm becomes very irregular and then they develop heart failure. So if you can detect and treat this early on, you can prevent a heart failure. A person going for unnecessary surgery, transplant, everything can be prevented. In very elderly people above 70, the blood flow to the brain comes down when they develop atrial fibrillation. So I'm talking to you, suddenly if there is a reduction in blood flow, I can't think of the next word. I can't remember a face. Slowly that leads on to dementia and worsening of the memory deficits. Now we had looked at about 600 patients with atrial fibrillation in our outpatient. This was published a couple of years ago. What you're seeing in black is all the high blood pressure is the commonest reason for atrial fibrillation worldwide. In India, heart failure because of valvular heart disease continues to occur in 40% of the patients. So the atrial fibrillation that you see in India occurs at a slightly younger age and it occurs due to different reasons. Thirdly, these patients develop clots in the heart which migrate to the brain. Depending on where it goes, they lose the eyesight or the power of speech. Now, how are we treating these patients? We were giving drugs to slow the heartbeat. So drugs, there are several drugs. But the problem when we give drugs is the patient feels better for 4 or 5 weeks. 6th week, he will come with suddenly no heartbeat because the drugs have become so high in the circulation, they completely suppress the natural beating of the heart. So suddenly the patients tend to faint and fall to the ground. So this increases the risk of sudden faint and head injury, and sometimes if they are not resuscitated, they can die. This is a patient again, came with atrial fibrillation. We gave a drug to slow down the heart rate, and within 2 hours, he develops a fatal heart rate. Luckily, his patient is in the ICU and we needed to shock the patient. If he was at home, he wouldn't have survived this. So these drugs have a significant side effects. For the last 3 years, we have been a prominent person in the community, 70-year-old. He was on 17 drugs for control of this heart rate and several other systems. And he was continuously developing this atrial fibrillation where, as you can see, the heart rate is very rapid. and irregular. We freeze one of the pulmonary veins from where, this is called the pulmonary vein, I'll explain to you later. This is a balloon which goes there and freezes the vein. As the vein gets frozen, you find the heart rate becomes normal, and this is about 3 years after follow-up. This patient is still doing well with very minimal medication, especially the blood thinner. Now, why are we talking about all these things? Now, if you take patients with atrial fibrillation, there's a very nice group of patients. What you see in red, the survival of patients with atrial fibrillation when they were treated with medical therapy, at the end of 5 years, less than 50% are alive. There's a high risk of death over the next 5 years. Whereas when you offer them a permanent solution like ablation, their survival improves significantly. What you see in blue graph, the survival is better. So to compare 180 patients, there is more number of deaths when they are treated with medical therapy compared to ablation. So this is not a theoretical entity. Significantly, the deaths increase with medical therapy. And secondly, these are patients, what you see, patients going for heart transplant. At the end of 3 years, more number of patients go to heart transplants compared to patients who are undergone catheter ablation. When you do catheter ablation, the heart failure slows down, so less number of people require transplantation. You can manage them with medical therapy. So we have looked at this burden of atrial. Colleague of mine, she is not here, Dr. Galji, did a survey in patients in Nagpur. And again, we did a survey in rural Andhra Pradesh called as APAF study. And the burden of this atrial fibrillations is still very high in Indian population, both in urban and rural areas. In urban population, that is like Hyderabad, the commonest reason for this is diabetes, hypertension, and overweight. Whereas you go to the villages, the commonest reason is valvular heart disease. Because of poor nutrition, they develop valvular heart disease. So the prevalence is slightly different. There are several treatments available, but fundamentally, if you want to tell your readers what can they do to prevent an atrial fibrillation, number one, if they are drinking, stop alcohol. Alcohol significantly increases the risk of atrial fibrillation. Number two, if they are overweight, they need to lose weight. Number three, if they are hypertensive, control of tight blood pressure is important. So over and above that, healthy diet and exercise, these are very, very important. And you need to reduce the risk of stroke by giving blood thinners. So blood thinners are very effective in reducing the risk of stroke. Now, if a person comes to the ICU and is very sick, we cannot do anything, but we give a shock treatment. You would have seen in movies, a shock being given outside that restores the heart rhythm back to normal. And that is what we do. Now, what I'm showing in a cartoon is, let me just go back to this. What you are seeing in a cartoon here are 4 veins. You can see at the back of the heart. Is there a pointer? I can see better. Okay. This is the back of the heart you are seeing. These 4 veins, these are the veins which are coming from the back of the heart. Now, these veins normally should fire it should go with the rest of the heart at 60-70 beats per minute. In atrial fibrillation, what happens is these beats, these pulmonary veins start firing very, very rapidly, and that increases the heart rate to 180 or 200 beats per minute. So traditionally, what we used to do is we go to this pulmonary vein and electrically isolate them with a catheter, with a heat therapy. Then last couple of years, I showed you an example where we used a cryo balloon where we freeze that area and cool this area, and that is cryo balloon therapy, and that is also very effective in, why is this not playing? Yeah, you can see this. That is a cryo balloon going into the vein, and it freezes the vein one by one. We freeze. For each vein, we spend about 4 minutes. So in all, once we go into this chamber, we take about 15-20 minutes to isolate the veins. And that is called cryoballoon therapy. And initially we used to do radio frequency catheter here, where we take a single catheter and go around this area and electrically isolate these areas point by point. These are the traditional treatments that are available. Now, what is the new thing that we are looking at? Good morning, all of you. We are really excited in the new era of therapy for atrial fibrillation. And as most of you would have known, we have a very large population of atrial fibrillation, that is irregular heartbeat from the upper chamber. It causes higher incidence of paralytic stroke, increases heart failure risk, and causes sudden death and even increases mortality. So we have been fortunate to have all the new technologies to improve the outcome of these patients. Several years ago, we started doing this with point-by-point ablation at the site of irregular heartbeat. So that it's called RF ablation. About 5 years ago, we started using cryo balloon to freeze that area with a balloon with very high success rate, close to almost 80 to 90% success rate. And now the revolutionary therapy is something called as pulse field ablation, where we put in a catheter from where the irregular heartbeat is coming and zap that area with a high voltage current. And this is not only very effective, and the safety is much higher because the surrounding areas are not affected by this therapy. The nerves around the foot pipe are all spared by this therapy, and therefore it's a highly safe and effective procedure. The upper chamber heartbeat la gundadada ekkuva vachina time lo lopala gadda form ana chances unnai. హార్ట్ లోపల లేని అది గడ్డ బ్రెయిన్కి పోయిందంట, స్ట్రోక్ రిస్క్ ఇంక్రీస్ అవుతుంది, హార్ట్ ఫెయిల్యూర్ రిస్క్ ఇంక్రీస్ అవుతుంది, పేషెంట్స్కి మార్టాలిటీ రిస్క్ ఇంక్రీస్ అవుతుంది. ఇది ఒక కొత్త ట్రీట్మెంట్ ఇప్పుడు వచ్చింది, PFA అని ఒక ట్రీట్మెంట్. నిన్న ట్రీట్మెంట్ స్టార్ట్ చేసాము AIG హాస్పిటల్లో. ఇదికి ముందు RF అబ్లేషన్, క్రయో అబ్లేషన్ చేసాము. ఇప్పుడు కొత్త డిఫరెంట్ ఫార్మ్స్ ఆఫ్ ట్రీట్మెంట్ ఇస్ అవైలబుల్ అట్ AIG హాస్పిటల్ టు క్యూర్ దిస్ ప్రాబ్లమ్, ఇంక్లూడింగ్ సర్జరీ. Ask my colleague Dr. Sridevi to speak also.
గుండెదడ, పక్షవాతం, హార్ట్ ఫెయిల్యూర్, ఈ 3 కారణాలు లేదా సడన్ గా చనిపోవడం, ఈ 4తో పేషెంట్స్ వస్తారు. గుండెదడ కామన్. ఇవి ఏమీ లేకుండా కూడా ఈ పేషెంట్లకి ఈ గుండెదడ ఉండే అవకాశాలు ఉంటాయి. సో దీనికి యంగ్ పేషెంట్స్ అంటే చిన్న వాళ్ళలో లావు తగ్గడము, ఆల్కహాల్ మానేయటము, సారా లాంటివి తీసుకోకుండా ఉండడము, నిద్రలో ఆబ్స్ట్రక్టివ్ స్లీప్ అప్నియా అంటారు, అది కరెక్ట్ చేయటము, బరువు తగ్గించడము, ఇవి చెయ్యాలి. వయసు పెరుగుతున్న కొద్దీ ఇది ఎక్కువ అవుతుంది. దీంతో హార్ట్ ఫెయిల్యూర్ రావడం జరుగుతుంది. సార్ చూపించినట్టు ఎక్కువ మందులు ఇస్తే టాక్సిక్ అయ్యి అవి హార్ట్ బీటింగ్ చాలా తగ్గిపోయే అవకాశాలు ఉంటాయి. దానికోసం కరెక్ట్ ట్రీట్మెంట్ ఈ అబ్లేషన్ అన్న పద్ధతి. ఆ అబ్లేషన్లో 3 పద్ధతులు ఉన్నాయి. ఒకటి హై వోల్టేజ్ కరెంట్ పెట్టడము, రెండోది ఐస్ పెట్టడము, ఇప్పుడు వచ్చిన కొత్త పద్ధతి ఇది PFA అంటారు. దీంతో చాలా వెరీ హై వోల్టేజ్ కరెంట్ ఒక షార్ట్ టైం ఇస్తారు. దీనివల్ల లోపల ఉండే కణాల్లో రంధ్రాలు పడి ఏదైతే దడ మొదలవుతుందో అది ఆగిపోతుంది. దీనివల్ల పక్షవాతం అవి వచ్చే అవకాశాలు తక్కువ, రికవరీ తొందరగా అవుతుంది. పేషెంట్ అదే రోజున కానీ మర్నాడు కానీ ఇంటికి వెళ్ళిపోతారు. ట్రీట్మెంట్ ఎంత మటుకు ఎఫెక్టివ్ అంటే ఇవన్నీ 100% ఎఫెక్టివ్ కాదు, కానీ అట్లీస్ట్ దిస్ ఈజ్ అ న్యూ థెరపీ, కొత్త పరికరాలు, కొత్త ట్రీట్మెంట్. దీనివల్ల బెనిఫిట్ 90% దాకా ఉంటుంది. ఆఫ్టర్ దిస్ వాట్ దే షుడ్ టేక్ కేర్. మందులు వాడాలి, వెయిట్ తగ్గాలి, ఆల్కహాల్ తీసుకోకూడదు, డైట్ మార్చుకోవాలి, ఎక్సర్సైజ్, వ్యాయామం తప్పకుండా ఉండాలి.
కానీ గుండె దడ అనేది ఏదైనా ఏజ్ సంబంధించిన
ఇది చిన్న వయసులో వచ్చే కారణాలు వేరు, పెద్ద వయసులో వచ్చే కారణాలు వేరు. పెద్ద వయసులో ఆ గుండె అప్పర్ లెఫ్ట్ ఎడమ వైపు ఉండే అప్పర్ చేంబర్ కర్ణికలు అంటారు వాటిని తెలుగులో. కర్ణికలు పెద్దగా అవ్వటము, వాటిలో ఏజ్ తో సంబంధించిన ఫైబ్రోసిస్ రావడము, వాటి వల్ల ఏట్రియల్ ఫిబ్రిలేషన్ పెరుగుతుంది. వేరే కారణాలు వెయిట్, ఆల్కహాల్, సారా తాగడము, బరువు ఎక్కువ ఉండడము, అబ్స్ట్రక్టివ్ స్లీప్ అప్నియా, ఇవన్నీ కారణాలు. చిన్న వయసులో కారణాలు వేరు.
If patient have BP, sugar, they are available for this treatment.
They need to be first controlled.
అవి కంట్రోల్ చేసుకున్న తర్వాత ఈ ట్రీట్మెంట్ తీసుకోవచ్చు.